Hi, I'm David Brown. I'm a retina surgeon for the Methodist Hospital in Houston, Texas. Retina surgeons have had a long history of perhaps straying from evidence-based medicine a little too soon. We're the types that likes to see a benefit and then runs with that benefit. And only later on does the study prove whether or not we're correct. A good example of this is steroids for diabetic macular edema, where when people started injecting it 3 to 4 years ago, most retina surgeons, including myself, jumped on the bandwagon saying, this is amazing. We can give a shot, we can get rid of the edema, we can get better visual acuities. The problem is, if you play golf, you remember the shot down the fairway, you don't remember the 2 or 3 in the woods. So you remember successes, and it's not until you analyze multiple patients in a controlled format can you tell, is it better than the standard of care? A recent paper came out from the Diabetic Retinopathy Study Research Network, which examined intraocular steroid versus focal grid laser, the standard of care, in a head-to-head fashion. The problem with focal grid laser is a retina surgeon or patient doesn't see immediate responses. It actually takes several months to get a response. And so in the triamcinolone versus steroid trial, it was shown that steroids were better than laser, but only for a short period of time. By 1 year, they were about equal. And by 15 months and beyond, patients who had regular focal grid laser up to every 4 months apart did better than those patients who had triamcinolone up to 4 months apart. In other words, the long-term results were that the standard of care, old, tried and tested, was actually better. I encourage physicians to always be wary of this and remember that until we do standard randomized trials, a lot of times we don't know, and the side effects of some of our newer treatments oftentimes don't come out until later. Cataracts, glaucoma also showed that on the side effect standpoint, the laser was better. We're doing further studies on both macular degeneration and diabetes so we can keep ourselves honest. This has been David Brown for the Methodist Hospital. Thank you very much.